Dr. Padilla, how could you describe poorly controlled diabetes affect your teeth?
Question. So how does diabetes affect dental health, right? So a lot of these doctors already talked about how diabetes affects vasculature and delays wound healing, right? And it's no different in the mouth. Some of the things that we see as dentists in general is patients that have decreased or impaired vasculature, they're going to be at an increased risk for gum disease, right? And there's varying stages of gum disease. The most mild, most common form of gum disease that most people have heard of is gingivitis, and all that means is inflammation of the gums. As gingivitis or as that gum disease advances, it turns into a condition in the mouth called periodontitis. And the difference between the two is that with periodontitis, it's not just the gums that are affected now, it's also the bone, right? So because of this delayed wound healing, it also leaves people open to infections, right? And we see that a lot with diabetics in the dental field. Another thing that we see as general dentists when people have uncontrolled diabetes is a decreased salivary flow. And so saliva is super important, not just because it helps cleanse the teeth off from the food and bacteria that builds up on the teeth, but saliva is also a buffer in the mouth that helps neutralize acidities from the foods that we eat and drink. People that have like stomach acid or heart reflux or acid reflux is another condition that we see a lot of, and because they have this very acidic environment in their mouth, they have a decreased salivary flow. Their mouth is just at an imbalance as far as pH goes, and teeth are at a constant state of remineralizing and demineralizing. And teeth start to break down, the enamel anyway starts to break down at a pH of about 5.5. And once that starts happening, it leaves the teeth at an increased risk for developing cavities, and then as these cavities progress, they invade the nerve, and then that's when you get things like toothaches, and eventually the nerve will die and an infection will follow. And then that infection, sometimes it's not just in the gums, but eventually manifests in the bone, right? And there's different ways that we treat that. But those are really the big things that we see as dentists, and how uncontrolled diabetes anyways, affects the mouth.
Is there any specific test? How do you diagnose if your teeth has been affected?
When we do our clinical exams, I mean, one of the first things that I'm always looking for is any lesions like in the mucosa and the gingiva. Because of the delayed healing, people are open to infections, right? And some of the first signs that we'll see when people have infections is like a draining sinus tract or an abscess, or just really something as simple as inflamed gums or gingivitis can be an indication of somebody that has uncontrolled diabetes. We like to take measurements with the perio probe. Basically what that measurement shows us, it's a measurement that we use a dental instrument to measure the space between the gum and the bone. And that gives us an indication of the status of the person's perio conditions, right? And this basically tells us, okay, is this person suffering from gingivitis? Are they suffering from periodontitis? Is there bone loss involved? Another sign that we'll see when patients are in the chair is, loose teeth. Sometimes patients will tell us is like, hey, I have this tooth that's really loose. Is there something you can do about it? And unfortunately, sometimes those patients are coming in with teeth that are hopeless or have a poor prognosis. And ultimately, the only thing we can do for them at that point is extract it. And you see, I wrote a few other notes here. So another thing that helps us diagnose also is X-rays. X-rays also give us a good indication if there's true bone loss. Sometimes people can have really swollen gums, pretty advanced or pretty severe gingivitis that they don't necessarily have bone loss that's involved. But definitely looking at X-rays will show us an indication of, okay, is it just the gums that are swollen, or is there true bone loss involved here? And so those are some of the things that we're looking for when we're helping diagnose patients with uncontrolled diabetes perio conditions.